Okay, welcome back everybody. So for our second segment, it's a similar photo as the first segment, which you'll notice, but this time we're going to be talking about the lower eyelid, and we're going to be talking about lower blepharoplasty. So for lower blepharoplasty, there's going to be two approaches we're going to talk about, one in this video, one in the next. So just like now to just kind of introduce the lower eyelid. So as we age, the lower eyelid is going to lose kind of some of its strong support mechanisms. So you're going to get pooching and protrusion of three fat bags that patients commonly complain about, giving them a tired look, fat descending from the lower eyelid. And while that's happening, also part of aging is you're going to get some laxity in the skin. You're going to get increase in crepiness of the skin, and that should be addressed as well and talked about during your consultation. So during that very important consultation, we're going to determine the degree of how much poochiness, how much protrusion of fat is going on in the aging phase, as well as do you have skin laxity issue as well with on top of fat protruding. And that's going to be important in determining what kind of approach we're going to take. Some tests we're also going to do is we're going to do something called a snap test to see is there a lot of skin laxity, and we're going to also make sure you don't have dry eye. So let's say you're a patient who has increase in the poochiness and protrusion of all three fat bags, plus some skin laxity, some skin crepiness. The red arrow here is going to show what kind of lower blepharoplasty approach we're going to take for you. So this is called a subciliary lower blepharoplasty. And what subciliary means, keeping it very patient-centered, is right below the lashes. So that's where that incision is going to be. You're going to make the incision right below the lashes, and we're going to identify all three fat bags. You can see there's a fat pad close to the nose. We call it the medial or nasal fat pad, then the middle fat pad, then the lateral fat pad. Right between the nasal fat pad and the middle fat pad, you see that brown structure. That's a muscle that's important in moving your eye. So we always want to identify it and make sure it's preserved. And lastly, just to show after those fat bags have been taken out, you don't want to take too much of it out, you don't want to look too hollow. But because we went with this subciliary right under the lash approach, you can also take some skin and that crepiness, that lax skin, you can pinch it since you made your incision right below the lashes and remove some excess skin, but obviously not removing too much. So you're removing skin as well as the three fat bags in this approach.